Hi, this detailed video of mine is about hair loss, that is also known as alopecia. It can affect just your scalp or your entire body, and it can be temporary or permanent. It can be the result of hereditary, hormonal changes, medical conditions, or a normal part of aging. Anyone can lose hair on their head, but it is more common in men. Baldness typically refers to excessive hair loss from your scalp. Hereditary hair loss with age is the most common cause of baldness. Some people prefer to let their hair loss run its course untreated and unhidden. Others may cover up with hairstyles, makeup, hats, or scarves. And still others choose one of the treatments available to prevent further hair loss or restore growth. Before pursuing hair loss treatment, you should talk with your doctor about the cause of your hair loss and treatment options. Now I will discuss the symptoms. Hair loss can appear in many different ways depending on what is causing it. It can come on suddenly or gradually, and it can affect just your scalp or your whole body. Signs and symptoms of hair loss may include gradual thinning on top of the head. This is the most common type of hair loss affecting people as they age. In men, hair often begins to recede at the hairline on the forehead. Women typically have a broadening of the part in their hair. An increasingly common hair loss pattern in older women is a receding hairline that is known as frontal fibrosing alopecia. Circular or patchy bald spots. Some people lose hair in circular or patchy bald spots on the scalp, beard, or eyebrows. Your skin may become itchy or painful before the hair falls out. Sudden loosening of hair. A physical or emotional shock can cause hair to loosen. Handfuls of hair may come out when combing or washing your hair, or even after gentle tugging. This type of hair loss usually causes overall hair thinning but is temporary. Full body hair loss. Some conditions and medical treatments such as chemotherapy for cancer can result in the loss of hair all over your body. The hair usually grows back in this condition. Then also there may be patches of scaling that spread over the scalp. This is a sign of ringworm. It may be accompanied by broken hair, redness, swelling, and at times oozing. There is a very informative video about ringworm on another channel. You can watch that video, okay? You should see your doctor if you are disturbed by persistent hair loss in you or your child and want to pursue treatment. For women who are experiencing a receding hairline, you should talk with your doctor about early treatment to avoid significant permanent baldness. Also talk to your doctor if you notice suddenly or patchy hair loss or more than usual hair loss when combing or washing your or your child's hair. Sudden hair loss can signal an underlying medical condition that requires treatment. Now I will discuss the causes. People typically lose 50 to 100 hairs a day. This usually is not noticeable because new hair is growing in at the same time. Hair loss occurs when new hair doesn't replace the hair that has fallen out. Hair loss is typically related to the factors which I am going to tell you. And the first one is family history. The most common cause of hair loss is a hereditary condition that happens with aging. This condition is called androgenic alopecia. Male pattern baldness and female pattern baldness. It usually occurs gradually and in predictable patterns, a receding hairline and bald spots in men and thinning hair along the crown of the scalp in women. Hormonal changes and medical conditions. A variety of conditions can cause permanent or temporary hair loss, including hormonal changes due to pregnancy, childbirth, menopause, and thyroid problems. Medical conditions include alopecia areata, which is immune system related and causes patchy hair loss, scalp infections such as ringworm, and a hair pulling disorder called trichotillomania. Also can be also are the factors in the causes, okay? Medication and supplements. Hair loss can be a side effect of certain drugs such as those used for cancer, arthritis, depression, heart problems, gout, and high blood pressure. Radiation therapy to the head. The hair may not grow back the same as it was before. A very stressful event. Many people experience a general thinning of their hair several months after a physical or emotional shock. This type of hair loss is temporary. Hairstyle and treatments. Excessive hair styling or hairstyle that pull your hair tight, such as pigtails or cornrows, can cause a type of hair loss called traction alopecia. Hot oil hair treatments and permanents also can cause hair to fall out. If scarring occurs, hair loss could be permanent. Now I'll tell you some risk factors. A number of factors can increase your risk of hair loss, including a family history of balding on your mother's or father's side, age, significant weight loss, certain medical conditions such as diabetes and lupus, stress, poor nutrition. Now I'll tell you some preventive measures. Most baldness is caused by genetics, male pattern baldness and female pattern baldness. This type of hair loss is not preventable. The tips which I am going to tell you may help you avoid preventable types of hair loss. First of all, be gentle with your hair, use a detangler and avoid tugging when brushing and combing, especially when your hair is wet. A wide tooth comb might help prevent pulling out hair. Avoid harsh treatments such as hot rollers, curling irons, hot oil treatments, and permanents. Limit the tension on hair from hairstyles that use rubber bands, barrettes, and braids. Ask your doctor about medication and supplement you take that might cause hair loss. Protect your hair from sunlight and other sources of ultraviolet light. Stop smoking. Some studies show an association between smoking and baldness in men. If you are being treated with chemotherapy, you should ask your doctor about a cooling cap. This cap can reduce your risk of losing hair during chemotherapy. Now I will tell you about the diagnosis. Well, before making a diagnosis, your doctor will likely give you a physical exam and ask about your diet, your hair care routine, and your medical and family history. You might also have tests such as blood tests. This might help uncover medical conditions that can cause hair loss. Pull test. Your doctor gently pulls several dozen hairs to see how many come out. This helps determine the stage of shedding process. Scalp biopsy. Your doctor scrapes samples from the skin or from a few hairs plucked from the scalp to examine the hair roots under a microscope. This can help determine whether an infection is causing hair loss. Light microscopy. Your doctor uses a special instrument to examine hair trim at their bases. Microscopy helps uncover possible disorders of the hair shaft. Now I'll tell you the treatment. Effective treatments for some types of hair loss are available. You might be able to reverse hair loss or at least slow it. With some conditions such as patchy hair loss, alopecia areata, hair may regrow without treatment within a year. Treatments for hair loss include medication and surgery. And I'll tell you some medication. If your hair loss is caused by an underlying disease, treatment for that disease will be necessary. If a certain medication is causing the hair loss, your doctor may advise you to stop using it for a few months. Medications are available to treat hereditary baldness. The most common option include minoxidil that comes with the name of Rogaine. Over the counter, non-prescription minoxidil comes in liquid, foam and shampoo forms. To be most effective, apply the product to the skin once daily for women and twice daily for men. Many people prefer the foam applied when the hair is wet. Products with minoxidil help many people regrow their hair or slow the rate of hair growth or both. It will take at least 6 months of treatment to prevent further hair loss and to start the hair regrowth. It may take a few more months to tell whether the treatment is working for you. If it is helping, you will need to continue using the medicine indefinitely to retain the benefits. Possible side effects include scalp irritation and unwanted hair growth on the adjacent skin of the face and hands. Finasteride that comes with the name of Propecia. This is a prescription drug for men. You take it daily as a pill. Many men take finasteride experience a slowing of hair loss and some may show new hair growth. It may take a few months to tell whether it is working for you. You will need to keep taking it to retain any benefits. Finasteride may not work as well for men over 60. Rare side effects of finasteride include diminished sex drive and sexual function and an increased risk of prostate cancer. Women who are or may be pregnant need to avoid touching crushed or broken tablets. Other medications. Other oral options include spironolactone that comes with the name of Carospir or aldactone and oral dutasteride that comes with the name of Avodart. Another treatment option is hair transplant surgery. In the most common type of permanent hair loss, only the top of the head is affected. Hair transplant or restoration surgery can make the most of the hair you have left. During hair transplant procedure, a dermatologist or cosmetic surgeon removes hair from a part of the head that has hair and transplant it to a bald spot. Each patch of hair has one to several hairs, micrografts and minigrafts. Sometimes a larger strip of skin containing multiple hair grouping is taken. This procedure doesn't require hospitalization, but it is painful, so you will be given a sedation medicine to ease any discomfort. Possible risks include bleeding, bruising, swelling, and infection. You may need more than one surgery to get the effect you want. Hereditary hair loss will eventually progress despite surgery. Surgical procedures to treat baldness are not usually covered by insurance. Laser therapy. The Food and Drug Administration has approved a low-level laser device as a treatment for hereditary hair loss in men and women. A few small studies have shown that it improves hair density. More studies are needed to show long-term benefits. Now I'll tell you some lifestyle and home remedies. You might want to try various hair care methods to find one that makes you feel better about you look. For example, use styling products that add volume, color your hair, use a hairstyle that makes a widening part less noticeable. Use wigs or extensions or shave your head. Talk with a hairstylist for ideas. These approaches can be used to address permanent or temporary hair loss. If your hair loss is due to medical condition, the cost of a wig might be covered by insurance. Okay, now I'll tell you another treatment approach that is getting noticed in the media. Okay, that is known as plasma platelet-rich plasma injection. Okay, PRP. Okay, this is a sort of there is not too many studies. There was a study in 2019 and that compared two groups of people using different hair treatments for 6 months. One group of 20 used minoxidil, Rogaine, and the other group of 20 used PRP injection. 30 people finished the study and results showed that PRP performed much better for hair loss than Rogaine. But the study also found that your level of platelets can affect how well your own plasma works for hair loss. A low level of blood platelets may mean that PRP is not as effective for you. Aside from treating male pattern baldness, there is a ton of research on PRP for hair. There is not a ton of research on PRP for hair growth, and it is not entirely conclusive. Okay. Well, so why all the hype? It is thought that PRP contains protein that serves several main functions that are thought to help hair regrow. These help your blood to clot, encourage cell growth, and there is some promising research suggesting that PRP may work for other types of hair loss. The first round of treatment takes a few visits to see initial results, and after the results start to appear, you will still need to get touch-ups at least once a year to maintain new hair growth. Now I'll tell you some potential PRP hair treatment side effects. PRP has some possible side effects from injection and from the procedure itself, including blood vessel injury on the scalp, nerve injury, infection at the injection site, calcification of scar tissue where the injection are done. Side effects from anesthesia used during the procedure, such as muscle aches, confusion, or bladder control issues, can also occur. PRP injections for hair loss before and after. Well, keep in mind that results will look different for everyone based on overall health, blood platelet levels, and hair health. Now you can see an image. Before and 7 months after the third treatment. Okay. Well, PRP for hair loss has some promising research behind it, but much of the research has been conducted on a small study group of 40 people or fewer. So it is hard to know if these results will work for everyone. And your own blood may not have rich enough concentration of platelets to be fully effective for restoring your hair through PRP injection therapy. You should talk to your doctor about getting your blood tested for platelets and checking your hair growth to see if you are a good fit for PRP injection therapy. Okay. Now I'll tell you there is a new treatment which is still under research, that is in the form of a tablet. Okay. Well, before discussing that tablet, I should tell you some steps for PRP therapy. Well, it's a 3-step process. Most PRP therapy requires 3 treatments 4 to 6 weeks apart. Maintenance treatments are required every 4 to 6 months. The step 1 is your blood is drawn typically from your own arm and put into a centrifuge, a machine that spins rapidly to separate fluids of different densities. In step 2, after about 10 minutes in the centrifuge, your blood will have separated into 3 layers, that is platelet-poor plasma, platelet-rich plasma, and red blood cells. The platelet-rich plasma is drawn up into a syringe and then injected into the areas of scalp that need increased hair growth. There has not been enough research to prove whether PRP is effective. It is also unclear for whom and under what circumstances it is most effective. According to a recent study, although PRP has sufficient theoretical scientific basis to support its use in hair restoration using PRP is still at its infancy. Clinical evidence is still weak. Okay, so this was about PRP, and then also it is like it is expensive. The price typically ranges from $1,500 to $3,500 for initial three treatments with one injection at $400 or more. Pricing depends on a number of factors including your geographic location, quality of equipment, and the addition of nutritive components. Okay. Um, Now I'll tell you the new research about a drug that can cure baldness. Well, new study shows some potential. Reversing hair loss is notoriously difficult, but a new study may bring scientists in one step closer to solving the hair loss puzzle. Okay. Uh, Hair loss is the result of both hormonal and hereditary factors. The truth is, hair loss is still a bit of a mystery. Okay. Now, this medicine, and there was a research in University of Manchester Center for Dermatology. They used samples containing scalp hair follicle from more than 40 male hair transplant patients. Okay, the hair follicles were placed in a medium and treated with the drug. Researchers said that those hair follicles were able to grow again because it suppressed the action of SFRP1. But this drug was used to treat is used to treat osteoporosis. They still have not mentioned the name of the drug. Okay. Uh, the research shows that it's novel because it blocks that protein SFRP. It is amazing that they were able to find the specific protein. Uh, for starters, it is the first study. Further, it was conducted in the lab, not on people. There simply is not enough research to draw serious conclusion yet about its long-term implication for hair loss. It is you can say it's a promising, but it's still in at a research stage. At first, the researchers conducted studies using cyclosporin A, that is an immunosuppressant. One of its side effects is hair growth. That set of testing led them to the SFRP1 protein and the discovery that the protein blocks hair growth. But cyclosporin A has too many side effects to pursue further testing, which is why they set their sights on the osteoporosis drug. It has few side effects. It should be noted that the scientists did not provide the name of the drug in their studies. Uh, the fact that this new agent, which had never been considered in a hair loss context, promotes human hair growth is exciting because of its translational potential. Okay. Well, I think this is enough because if I start discussing everything, the video will get more lengthy. So generally, what at the end, I just want to advise you that the treatment options are available. Different treatments. Some people may opt for hair transplant. Some people will go for laser therapy, and also there is a PRP also. So it depends upon you and depends upon your budget which option to choose from. Okay. Thanks for watching this video. See you in next video. Bye for now.